welcome everybody back to another Lady Leaders webinar. We know obviously so many men listen to. We're so grateful for the people who, come to us as a resource for lots of different things. I've got to hear from so many of you guys, and I'm really grateful that what we're talking about is resonating. And if there's ever things you guys want us to talk more about, please just post it in the chat. We'd love to know. But I'm really excited. You can definitely Ashley can attest. I'm really excited to bring on somebody that has become really important in my life, and that is the amazing somatic therapist, Lauren Zoller. I'm going to let her kind of fill everybody in about who she is and what she does, but I met Lauren through another group that I'm a part of other entrepreneurs that are non-dental. And I saw her on my friend's webinar, Jill's webinar, and Jill was raving about her. And that's how I found her. And when I listened and when I got to talk to Lauren, I was like, this is it. Like, I know a lot of us have done a lot of work and we've, really worked on ourselves and being better leaders and being better entrepreneurs. But for me, this was such a cool piece that I had never even heard about. And it's really changed so much of how I approach my days, how I approach my mornings, and really just kind of how I walk through life. So Lauren, I'm going to give you a couple minutes just to introduce yourself, your work, your bio, all of that.
Yeah, awesome. Well, I'm just excited to be here. Thank you guys so much for having me. So what I do, my work specifically is I am a somatic experiencing practitioner, which is just a fancy term for a somatic therapist. And if you're joining us and you have no idea what somatic therapy is, simply put, it is therapy of the nervous system. So I work primarily with men and women and helping them repair relational ruptures based on past trauma and the way that that shows up in the nervous system. But because I am trained in somatic therapy, I do a lot. I educate a lot of leaders and entrepreneurs all about how to navigate burnout, how to not feel like you're constantly in survival all of the time in your body and in the way that you approach your work. So I know that's what we're going to be talking about today. I know we're not going to be weighing heavy on the relationship side of things, but truly, when we talk about life in general, everything is a relationship. You're in relationship to yourself, you're in relationship to your patients, you're in relationship to your spouses, your friends. So it all does get tied together, and how we do one thing is how we do everything. So that's what we're going to be talking a little bit about today.
That's amazing. Yeah, I will say, like, getting the chance to work with you, that's exactly what I noticed is, I came into it with one mission, but then really what I noticed is how it bled into everything. And when I thought that maybe I was pretty good with communication and leading before, this has been so much of, I think I could see how I can lead better and communicate better. Even just how I posture myself has changed just because of so much of what I've learned from you. So I'm so excited for everybody to get that opportunity to hear from you today. So, the thing that and the reason I wanted to bring you on, and Ashley, I'd love to get your take on this too, but so many of the calls that I've taken, and I've taken, honestly, these last couple months have been the highest ever for me. And so many of them have been kind of secret SOSs. The behind the scenes, hey, Summer, I think I need to hear I'm okay or I'm normal, or like I'm just feeling really out of sorts. I think what I'm hearing is unsure about the future. I hear a lot about anxiety, overwhelmed. I do hear, I don't want to say the word burnout is usually what they say, but I feel like maybe that's where I'm getting close to. So Ashley, I don't know if you can attest, especially with your line of work, if you're hearing it too. I asked Addison too, but I'm hearing a lot of that.
Yeah, I can only it's very similar. It's, I'm just we joke that we don't say the O word is overwhelmed. Like we used to say that. And that was just because we were so terrified of what that would mean. Come a long way in that time frame in coaching, but I know that that's where a lot of business owners, these are practitioners who are owning their own practices, who are trying to have families. Like the O word is real, and it's challenging, and it just feels like like way too much sometimes. And so, yeah, I'm hearing the same things, I guess is the point.
Yeah. And I think the thing that's sad for me, Lauren, is they, because you work with entrepreneurs, they put everything on the line to be able to do this. So they sacrificed, they did loans, they did everything for this dream. They get into it and there's very little joy sometimes. They're trying to, like Ash said, trying to manage a family, especially if they're moms too, or dads, they're trying to do all of this. And I do think that they sometimes begin to resent the very thing that they've poured so much into. So I'm going to let you just kind of speak to that with clients and then kind of let you take it from there.
Yeah. So it's interesting when we talk about overwhelm and the B word. I know the O word is overwhelm and the B word is burnout. And when we specifically speak about entrepreneurs, and I know that this is mostly dentists, it's interesting because in order to be an entrepreneur and to really step into that line of work, it truly takes a special type of person. And I always tell people, and me included, because I'm an entrepreneur, that my business really, in a lot of ways, was my coping mechanism. It was the way that I could feel like I had significance in the world. And I felt like I was worthy of having certain relationships. And so oftentimes we'll notice that with entrepreneurs and with really high achieving individuals, there's this sense of deep significance that comes with their work. Mm-hmm. And that's a really beautiful thing. And when you harness that, it's fantastic because it really does, it creates people that can make massive impact in the world. But the negative side of that, when we're looking at the actual nervous system and we're looking at the way that it affects the body, is that oftentimes these very same things that make people high achievers and successful entrepreneurs, these coping mechanisms for significance, are also coming from a space of survival. And if we look at it and we track it back to childhood, most entrepreneurs and most high achievers come from a family dynamic where they felt like they needed to prove themselves to a family member or to fit in with a certain friend group. And this became their norm. And so they achieved to receive praise and significance. They also did whatever they needed to do to fit in. And this created what we call a survival pattern inside of your tiny little nervous system when you were a kiddo. And so what happens is that you grow up and you become an adult and you do all of these really amazing things. And you create a dental practice that's running on 15 cylinders and you're able to achieve all of these things, which is great. But underneath all of that, there is this sense of survival that's still ticking. And so what I really want people to get curious about is that there is a reality that does exist as an adult and as an entrepreneur, where you can have success, you can have significance, and you can start to look at some of these survival patterns and question them and start to lead your body to a space of safety so that you can operate from the space of being high achieving, but not tapping into that O word and that B word, the overwhelm and the burnout. And oftentimes a lot of entrepreneurs, they are not questioning that. They're not getting curious about it. And that's why it leads to this cycle of just constantly feeling like you're on the hamster wheel over and over and over again, because truly what got you to the place where you are right now as a successful entrepreneur is fantastic, but it's not sustainable. And that's why we have to start to look at the nervous system. How can we start to introduce safety so that we can start to get curious about these survival responses?
Mm-hmm. Well, that leads perfectly to my next question of, I thought before I started working with you, I thought I was actually really self-aware. I thought I did know, and that's what I found so interesting on that other webinar that I was listening to, that I thought I was aware of it. And I would say that so many people listening to this are going to be like, no, I think I've done a lot of that. Like Ashley, like I know you have too. So many people are like, no, I think I've done it. It wasn't until I started working with you that I even recognized there was so many times that I was living potentially in more of that survival type response. And I had gotten good at it and I was able to do it, but I didn't even realize it was there. How do people know? How do they know to become aware? How to become aware?
Yeah, great question. So the first thing I'll say is this. The majority of us have been conditioned, and it's not your fault. It's just the way that the world has conditioned all of us. We've been conditioned to think very cognitively about a lot of things in the world, right? We're really great problem solvers with our brains. When something is going wrong, we can figure out the solution. And what I want everyone to understand is that when we're speaking about the nervous system and we're speaking about survival patterns, the nervous system does not speak in logic, cognitive awareness, or story. So all of these mechanisms that you've created to think your way, something's going, you're overwhelmed, so I'm going to think my way out of it. All of these cognitive modalities that you've attached to trying to figure out a problem, you're actually still in survival because your nervous system speaks in sensation and emotion. And most people have never learned that language. So what I mean by this is that you could sit here and tell me dead in the face that everything's okay and that you're not overwhelmed and you've got it under control. You can verbalize that to me. But your nervous system could be telling a completely different story. Your nervous system could be, your heart could be racing. Your heels could be lifted off the floor. You could be telling me you're okay, but you're starting to clench your fists. And that is your body telling you that you're in a fight flight response. You're not actually okay. You're in survival. And so until you start to learn that language, until you start to really understand, what does flight look like? What does fight look like? What does freeze and fawn inside of my body? What are the symptoms associated with it? Until you can speak that language and also know what safety looks like, you're just trying to think your way through life. You're not feeling your way through life. And so that's the first step, is to really start to understand the language of your nervous system, which is sensation and emotion.
Which, there may be people who think, I don't have time for that, or I don't even have time to stop and emotion, right? Like I've got to think my way right out of this. I don't have time. Like I don't have time to do this. And, I think one of the things, and I'm sure it'll be brought up again, is it's kind of like when I tell people, when I say, like, you've really got to sit with this person for multiple times and teach, and they'll say, I don't have time for that. And I'm like, well, then you obviously don't want something to change. Like you want to keep reliving the same thing over and over. If you don't want to spend the time now to make it better long term, this is kind of that same thing. Is it feels almost woo woo. It feels like there's no science to it. It's just like, oh, so I need to figure out my emotions. What do you say to those people? Where is it similar to that analogy of sitting down and spending the time to teach that person so that they are able to do that task for forever? Is it kind of that similar analogy?
Great question. And what I want to approach first before we go there too is the notion that this is woo-woo and not scientific, because truly this is extremely scientific when we break it down and we look at it. Because when we look at the nervous system is the most primal part of our makeup as humans. And every mammal on the planet has a nervous system. Okay, whether you're a tiger or a human, you have one. And your nervous system is in charge of two things and two things only: to get you the heck out of Dodge when threat is present, and to help you rest and digest when you're feeling safe. So if a bear were to enter the room that you're sitting in right now, your nervous system would automatically react without you thinking about it. Your brain would actually shut off. It would go offline. Your heart would start to race. Your heels may start to lift. And your body is automatically, without you thinking about it, going to get you away from the bear. That is science. That is your physiology saying there is threat in the room. Get me the heck away from danger. Okay. So when we talk about the nervous system, we talk about feelings and emotions, we're actually talking about science and your physiology. Because if you think about it, when a bear enters the room, right, you're feeling fear. You're also feeling sensations of probably anxiety. That's all showing up in your system. And so it's giving you a language. We're just not speaking it verbally. We're having to tune in. And if you were to stop time in that moment when that bear enters that room, and you were to take a moment to notice what's happening in your body, right? Your body is going to give you a lot of clues that there's threat present. So when we talk about it, and I like to just kind of put that out there, because we can often think, okay, feeling my feelings and emotions and noticing sensations is woo-woo, but it's actually extremely scientific, right? Like down to the physiological level. And so we have to remember that. We definitely have to remember that. And I'll also say this, that to answer your question about if you don't slow down and learn this, is it basically like saying, I don't have time to train someone? And the answer to that is yes, absolutely. And I want to circle back to what I just said. When the nervous system is in survival, the brain goes offline. It cannot function properly. That is part of your physiology. It shuts down your brain so that you can go into the most primal part of your being as a human to get away from threat. So your brain's not even functioning properly when you're trying to problem solve if your body is in a survival response. So you have to learn to speak the language of the nervous system first, because it precedes what happens in the brain.
So if we're looking to be super high functioning leaders, entrepreneurs, it actually behooves us to be able to truly figure out, how do we move ourselves from survival type mechanisms, which we may not even recognize are inside us, and be able to move to that place where we can actually be, at that lower level where we are coming from that place of safety, alignment, calm. It actually behooves us, for the sake that we're actually going to ultimately go further faster. Kind of like the spending the time to teach now versus not.
Yeah, it's the magic ticket. It's the magic ticket, because when you can master that, you have clarity in your thinking. And your body also feels like it doesn't have to go into the O and the B word to survive, because the O and the B word, they are just survival. If you just take away overwhelm and burnout and just put survival in its place, fight, flight, freeze, and fawn, that's all it is. You're just hanging out in those survival responses, and you can't do anything there. You just can't function. You can't have a relationship with yourself. You sure as heck can't have a relationship with your coworkers, with your patients, with your spouse. You're going to constantly feel like you're on that hamster wheel all the time.
Yeah. And that's the symptoms that then they actually sometimes feel, as the lethargy, the exhaustion, the racing heart. All of that shows up maybe later because they have been living in that survival.
Exactly. And that's a great way to start, though, the conversation of understanding, how does my body feel? Because if you're feeling that regularly, that is a big fat sign that you're operating in survival.
Yeah. The butterfly feeling in the chest consistently, that just constant low level lethargy, just feeling exhausted all the time. It just might be time to stop and actually check in and see what's going on. A question that I did have is, when you start working with people, men and women, do you notice that they experience it differently? Do you notice it? And it's probably a huge generality, but do men find feeling the sensations, the nervous system, starting to calibrate with it different than a woman would?
So yes and no. I always giggle and I laugh with my team, because it's normally, and again, we are talking in generalities, you're right here, but normally with men, once they've decided that they're in, they're like, I'm going to do this. Like, I'm committing, I'm going to feel my sensations and emotions. I'm going to start to speak this language. They can tap in so quickly. We as women, normally, again, speaking in generalities, we tend to, that muscle, that flight muscle of overthinking is so strong for us, because we had to overthink to survive, that oftentimes what I notice is that it's much, women are more willing to go there because they love sensations and emotions, but they overthink it. They want to get back into that flight response of being in the brain, where men are just like, let's get in. And the moment they're in, they can tap into their body and they can feel. But it just depends, again, on what you've experienced in your past. and how your body has held on to these survival responses based on what you've gone through in your childhood, in your relationships, in every instance that you've had in your life. So it really just depends.
Mm-hmm. Yeah. I'm just curious because I would actually guess that, but the overthinking thing, I would say I can see that for sure. You know, women want to tend to overthink all of that. And actually I think women even know that about themselves often. Ashley, tell me though, you know, what has been your experience? You know, obviously you get to work with men and women doctors quite a bit. Like, do you notice when you talk to them, you know, because you have a lot of this kind of training or background too. Do you find differences between the men and women when you talk to them for your clients? She, by the way, Lauren, I should say she helps doctors find assistants to help them when they're overwhelmed, when they have too much on their plate. So she helps them delegate.
And I've also been an assistant who had a lot on their plate. And
Yes.
so this is all, yes.
Yeah.
You know, I don't know if I see, I think kind of when they've come to me and they're realizing they need an assistant, you know, they already are realizing I need help in some type of way, type of thing. I do really, really appreciate you getting on the scientific level of like, no, this is your anatomy doing what it was trained to do as, you know, lizard brain or whatever, you know, like from our core days. You know, this is literally built in. And also I keep thinking about, you know, what got you to where you are isn't necessarily what will get you to where you want to be. And so I'm very excited to hear more, but I'm not seeing a ton of difference when it comes to men and women. But when there is kind of that, just like, I don't know, they get to like a blank state where they're just like shutting down, you know, I'm just tired, you know, it's I'm tired, I'm overwhelmed, I'm burnt out, and it's heartbreaking. And it happens more often than I think people want to admit as well.
And for men as well, which I think can be hard for them to admit. That's what I would say is I notice what the difference is. I get sometimes the SOS calls that are the men saying like I burn out too, you know, or I get to that saturation point too. And the thing that is really so sad, it makes my heart so sad, is I know so many of these male doctors are truly some of the kindest, most amazing dads. And that's where they're feeling really tugged and pulled. And you hit it on the head, Lauren. They don't feel like they can actually feel good and present anywhere. And I think it's a burden that's been hard for them sometimes to even share. So I love the opportunity to get to help them, you know, feel okay about it. But that's one of the things that I've noticed is sometimes even just wanting to admit that you know, both men and women are there. Because so many women are such high achievers too, that it's hard to admit that they're there. But anything else on that when it comes to men, women, and getting to that place of awareness?
Yeah, I think, you know, we just have to take into account culture and the way that, you know, you were raised. And just because of the way that we were raised, women were taught different things and men were taught different things. So, and it all just depends, like it's all based in your upbringing and what you've experienced. And I think that the first step, I always say, I try to break down healing and therapy to the most minuscule level, because I feel like people have made it so complicated. And it really doesn't have to be. And there are 2 steps and 2 steps only to healing. There is awareness and there is choice. And so the first step is always awareness. So if you feel like you're struggling, if you feel like you can't be present with your family and you can't be present when you're at work and you're feeling pulled in 8,000 directions, that's the first step, is awareness. You have awareness around it. Now reach out and figure out what you need to be able to choose differently. Find that tool that can help you choose differently. And so really we make it so difficult. But I think that you kind of hit the nail on the head by saying, hey, men, when you're aware, reach out, because that honestly is more than half the battle, is that awareness piece.
Right, for sure. Because it's so prevalent. It really is. And I'm here to say that it's so prevalent. I think all 3 of us, because we talk to a lot of entrepreneurs, high achievers, doctors, things like that. It's very, very common. I want to move into what I'm hoping, Lauren, you can really kind of dig into, because we did discuss the science of it, which I also love. And I want to set that really is the foundation of it, because I understand my own peers of like, okay, help me understand truly scientifically if me doing this is going to be, helpful. So I think we've dug into that, but, I want to figure out, how do we actually, when they know they have this choice, they know they want to do something, where do they actually go from here? What is the strategy? Where do they go? Because I do want to give everybody some tactical things potentially that they could do at this point.
Yeah. So I'll give a tactical exercise that everyone can try on. And regardless of where you are in your journey, you can start. And then we'll talk about, if you're looking like you need some deeper support, where do you go? How do you even find support when it comes to somatic therapy? So the first place that I always like to start everyone when you make your way into the somatic world, and I'll tell you that I had a mentor of mine tell me a few weeks ago that my biggest life challenge is going to be trying to make somatic work make sense to people, because it's complicated, right? To become a somatic therapist, it's almost 8 years of training that you have to sit through. The nervous system is complex. So what I hope by giving this exercise to everyone is that this can help you start in a very simple way to make it tangible so you can understand it. So as we spoke about just a few moments ago, the nervous system speaks in sensation and emotion. And that's a language. It's just like learning Chinese or Spanish, okay? You can't just decide that you're going to shift your nervous system without understanding the basics of your nervous system and the language that it speaks. So since the nervous system speaks in sensation and emotion, what I want everyone to do, and this is a simple exercise, is to take your phone and to set 3 timers on your phone throughout the day. And you could set it for an hour after you wake up, somewhere around lunch, and maybe an hour before you go to bed. And when that timer goes off, you are going to this should take no longer than 5 seconds. You should take 5 seconds to acknowledge and write down in your phone what sensations you feel, what emotions you feel, and what you were doing when the timer went off. Now, notice I didn't say what sensations, what emotions, and why do you feel that way? Right? We're not going to make cognitive sense of why you feel the way that you feel. We're just noting how your body feels in a present moment. And you may be sitting there saying, okay, well, what's this going to do? I don't understand it. And what this does is it teaches you the language of your own nervous system. And I want to challenge everyone that's listening to this to do this for at least 2 weeks, every day, morning, noon, and night. And what you'll do after you do this for 2 weeks is I hope that you go back and you start to look and see if there are any patterns. If you notice that when your timer goes off at noon every day, that you're sitting at your desk and you're typing an email or you're filling out patient records, and you notice that your jaw is clenched and your feet are lifted off the floor, and you feel this constriction in your low belly, that's a really good sign that your body is in survival. It's in a flight response. It's not in the space of safety, which feels relaxed and calm and peaceful, and you feel like you can just kind of melt into your chair. So this exercise will start to teach you the language of your nervous system. And if you notice every time that the timer goes off and you're writing an email that you have these responses, that's a pretty big clue that you might want to start to look at those responses, either with a trained professional or start to get curious for yourself. So that's a really great place to start. If you feel like you are constantly, after you do this exercise, if you feel like you're constantly in a space of survival and fight, flight, freeze, and fawn, and we can talk about the symptoms associated with those 4 in just a moment. If you feel like that's your norm, that's your baseline, then you probably should reach out for some support.
And you were saying, and I know, and I kind of start with you, that the majority of people, and I'll let you correct me here, but the majority of people actually live there a lot of the time. They're living life like that, thinking it's normal.
Exactly. Yeah. And I want to say too, Summer, that it's not bad to be in activation.
Mm-hmm.
It's not a bad thing. Okay. We're not meant to like float our way through life and be little fairy clouds. That's not the goal. We're not supposed to get there. But what the goal is, we want you to have a flexible nervous system. We want you to be able to go into healthy activation and notice it without spiraling into what we call the trauma vortex, or what we call outside of your window of tolerance, to where you are in full-blown survival and you're a tornado. You're just blowing through life. And so the goal is to find that sweet spot of healthy activation and safety, and what that looks like, and how to have a relationship with both of those, so that you're not constantly living in outside of your window of tolerance. You're not in that constant state of hypervigilance and hyper survival, or hypo vigilance.
Mm-hmm.
And that we don't want you to be too high or too low.
Yeah. Flexible nervous system, agility, agility of the nervous system. Yeah.
Mm-hmm.
To be able to activate when you need it, but not have to live there all the time to just get through everything.
Yes. Yeah. And to not have that high activation be your baseline, which is what you were speaking about. Yeah. Most people are there and they don't even know they're there. And then they have the lethargy, they have the headaches, they have the butterflies, and it's constantly there. And so what happens, they think they have anxiety, they think they have a medical condition. So then they go and they get medicated for it. And all you're doing is you're just masking that survival response. When in essence, if you just learn to have a flexible nervous system, it could probably heal a lot of those ailments.
Yeah. So go into, part of that activation phase, like you were saying, is the fight, flight, freeze, or fawn. Tell people what that means and what are we looking for when we're doing this awareness exercise. Our timer's going off. We notice, when do we start to decide, is this fight, flight, freeze, or fawn?
Yeah, great question. So I'm going to speak in generalities here. And you have to remember that every nervous system is different. So it can show up differently in your body, and you can experience one or all four of these survival responses at any given time. Okay. So if we're talking about the fight response, we'll start fight. It is a sympathetic nervous system response, and it's just like it sounds. You want to fight things. So you'll notice rage in your system. Oftentimes, as far as physical symptoms are concerned, I will see clients clench their fists. I will see their eyes get really big. Some of my clients will flush, like they actually want to take action and hit someone or something. You also will notice that heels will lift off the floor because you may want to kick. You feel this sense of internal rage, like you actually want to fight. Like if there was a bear in front of you right now, you would fight him to your death. Okay. We also notice when we're in a sympathetic response that the heart rate lifts, that the blood starts to rush from your vital organs to your extremities. You may notice that you have tingling in your fingers and toes. You may also feel the urge to actually want to move towards something. Okay. So that's how the fight response shows up. The flight response is very similar to fight. They're both sympathetic charges in the system. The flight is just like it sounds. It's you wanting to get away from the threat. So again, heels may lift off the floor. If I'm working with a client, I may even notice that they start to angle their body towards an exit because they want to get out, right? So notice that even in your own day-to-day, do you tend to position yourself towards a door when you speak to someone or when you're working at your desk, right? There's that constant, I want to get away from whatever's in front of me. Again, physical symptoms would be heels lifting, heart rate feeling like it's going to beat out of your chest, eyes dilate. You may even feel sweaty, the tingling in the palms again and the feet. So again, it's that movement towards wanting to get away. That's the flight response. Now, the freeze fawn response are parasympathetic nervous system responses. And so the freeze response usually comes in when the fight and the flight response aren't working. So if you think about it, if you're trying to get away from a bear that suddenly appears in the room and you have tried to fight him and you have tried to run away from him and he has cornered you, the next thing that your body is probably going to do, because it's out of options, is it's going to try to play dead in hopes that this bear will have mercy on you and not maul you to death. Okay. So the freeze response in your system looks like deer in the headlights. It also looks like disassociation, right? You may not remember memories that you've had in the past. It can also feel really cold. If you have really cold hands and feet, oftentimes it's a sign that you live in the freeze response quite a bit, even when it's warm, like not because you're outside in the snow, right? when you're doing normal things, because in the freeze response, the blood rushes from your extremities back into your vital organs to preserve your body, to play dead. It wants to use as little energy as possible. So you may feel numbness in your extremities. You may feel cold. You also may feel like your breath is barely there, super labored breathing. And there's just this sense, I always know when a client is in freeze because they're frozen. They look frozen. It also looks like, if we're looking at it from a psychological standpoint, it looks like depression, like not wanting to move and get out of bed or make movement towards. Okay. So that's the freeze response and how it shows up. The fawn response is very interesting because the fawn response was just introduced to psychology a very short time ago. And the fawn response is a parasympathetic response. So inside, it mimics freeze. Okay. You will notice the same wide-eyed shut down, feeling like you don't want to move towards, but you want to shrink in. Okay. You'll notice that internally. But what the fawn response is people pleasing. So it's discounting your truth to appease someone else. So people ask me, okay, well, how does this relate to a bear being in the room? If you were trying to freeze and play dead and it was still mauling you to death, you would probably start to bargain with this bear. Like, please, like, don't kill me. I'll give you all the money in my bank account. I will do whatever you need. Just please do not kill me. That is the fawn response. And we often forget about that response because it's so conditioned in so many of us, but it looks very similar to freeze.
That's so interesting. I'm like, Ashley, I have so many things that I'm thinking through to myself that I was like, wow. So really for so many of us, we don't potentially have that flexible nervous system. We're just so conditioned because of childhood that we have lived in a lot of these survival mechanisms that we don't even realize we're doing. But what I found really interesting is that if the fight or flight's not working, like we can't get away, we can't fight it off, we can't argue it out, or whatever, we will naturally move to more of that freeze or fawn response. And it's funny, when Ashley, you were talking to me, or when you were saying that a lot of the clients almost appeared shut down, I'm like, they probably had moved. Then in my head, I was thinking they had tried what they knew to do. They had tried to fight it. They had tried to flee it or have to bury their head in the sand. And they got to that point of, which breaks my heart, like the freeze, just they didn't know what to do. So they just kind of started to shut down. But that whole thing is really fascinating as to what we just naturally do and never question it. Ashley, I don't know what you think.
I think you're saying it all, and not that I'm sitting here analyzing all of my behavior at all. That's not like I feel like you're talking to me at all or directly. This is my one-on-one session here. But no, I think Summer said it like it's like I'm making a lot of connections in the people that I talk to and seeing those different responses, and like it's really the fawn one, like you said, it's interesting that that's like a newer thing, right? And I'm like, oh. There's a lot of dots being connected in my brain right now. So that's where I'm at.
Yeah. So, let's say, as really the whole goal is to just get people aware, right? And especially with all of us hearing, how many people right now are feeling this level of all these different words we're talking about: burnout, anxiety, shutdown, maybe just a little bit, just bleh. The whole goal of this was introducing them to something that could start to change this from being that hamster wheel, moving them from surviving to ultimately actually finding the joy in their family and at work, because that's how you started this whole thing, Lauren, was it can be both.
Yeah.
It doesn't have to be one or the other. So that's what we're really, just to kind of bring everybody back, that's what we're trying to accomplish here, is introducing everybody to that. And so with that, your first tip is just the awareness piece, setting the timer 3 times a day, 2 weeks, jot down somewhere. The 3 questions you said were, what am I feeling?
Mm-hmm.
What was I doing when the timer went off? And what was the third one?
So sensations, what sensations are present? What emotions or feelings are present? What was I doing when the timer went off?
Okay. So they do that. They see it. What they notice is they're like, wow, after listening to this, I do realize I have either a lot of rage, or I feel a lot of anger, or I feel a lot of butterfly anxiety, or I feel frozen a lot, or I'm just barely walking through life almost like a ghost, like just getting through the day. So they see it, they know they potentially need support. Where do people even turn? Because if I'm being completely honest, Lauren, sometimes even that feels like I don't even have time for that. How do I dedicate more time, even though I see the benefit of this? Can I do it somehow myself by reading a book, or just, is there something I can do myself to make it all better? And if not, like, where do I even start, and how do I make time for this?
Yeah, great question. So I'll say this, you can definitely read a book if you want. However, when it comes to somatic experiencing and somatic therapy and reintegrating these survival responses to move towards survival, I'll tell you that there's nothing like somatic therapy and doing that in an accelerated way. However, I'm going to give everyone options for all different levels. So depending on where you are, you can choose what feels best to you. If you want to read a great book and you want to just start to understand the nervous system more, there's a fantastic book out there by Dr. Peter Levine. He is my mentor. He is the god of somatic experiencing. It is called In an Unspoken Voice, and it is fantastic. And it talks about the nervous system and how all of this works. He also has a great book called Waking the Tiger. That is another, it's a little bit of a deeper read. If you make it through in an unspoken voice, you can start to make your way into Waking the Tiger. Now, I will say this, you can absorb all of that knowledge. And if you do not know how to actually use that knowledge to reintegrate it in your system, you're going to feel pretty stuck. You're going to have all this knowledge up here cognitively, but your nervous system is not going to be able to shift. So if you're the person that wants to actually start to step into support, I would suggest there's a fantastic website called the Somatic Experiencing International website. I think it's SEI.org or somaticexperiencing.international.com. I'm not sure. And you can go there and you can actually search for somatic therapists in your area. So I would start there. You can also reach out to me. We have openings for, select one-on-one clients if you're looking for some more in-depth work. But I would say, look at hiring a somatic therapist, and also make sure that they are trained by Somatic Experiencing International, by SEI. There are a lot of practitioners out there right now that are trained in somatic modalities like breath work and tapping and meditation, but they are not actually somatic experiencing practitioners and somatic therapists. They're not trained in how to renegotiate survival responses and trauma in the body. So make sure that you find someone off of the SEI website.
And Ashley, is there a chance I wrote the books down. Is there any chance you have the website? Okay, perfect. Just so that we can have, because I'm sure people, if they were driving and listening or what have you, we might just want to have some of these,
I'll add that in the comments for sure.
Awesome. Thank you so much. And, I think people may listen to this, do some of those exercises, become really aware of it, and they may choose, let's start with the book and see about that. Let's go to the website, see if there's somebody that would make sense for me. But what I can say is, from personal experience, and like I kind of said in the very beginning, I was that person who had read the books, who had done a lot of the stuff. And I didn't even quite know. I didn't. There was no way without your help was I even aware of some of my own kind of survival things. And for me, it's not like it's done, one and done. I can say that, it's something that you have to be conscious of. But the cool thing is now I have better resources to be conscious of it, to recognize when it's happening, and to be able sometimes to even remove myself for a second to let myself get back to, okay, like I'm okay type thing.
Yeah.
So I appreciate having multiple different ways for people to seek out whatever support it may be. And I'm thankful for all of that. But, when it comes to being able to build that resilience, that flexibility, of the nervous system, that really does seem to be the key then that allows people to truly experience joy, not just happiness, but true lasting joy despite the circumstances. Can you speak more when it comes to entrepreneurs? Because I'm sure they come to you because they're in these survival, places. How do you help them develop that resilience? And how do you help them start to truly experience the joy that's more long lasting and can be more consistent?
Yeah. So without getting too technical, what we do in somatic experiencing is we're starting to renegotiate where your body goes into not feeling joy and introducing joy in the moments that you don't feel joy. And by doing that over time, what ends up happening is that joy starts to take over. We call it, if we do want to get technical, we call it being in your trauma vortex and introducing a counter vortex. And the more that you introduce a counter vortex when you're in a trauma vortex, the body starts to feel safety. And those stuck survival responses start to feel safe enough to renegotiate in your system. And so the more that you do that, the more that the body says, oh, wait a second, this one thing that used to send me spiraling, I don't have to do that now. Right? Like everything's okay. I can actually be joyful about this. The ceiling's not going to fall down. The business isn't going to close. It's going to be okay, because we're starting to work with those triggers in the body and allowing joy and safety and peace to override the trauma vortex. So without getting extremely technical, that's what we're doing, is we're just introducing more joy, more safety, more peace in those moments when you feel like, because I'll take you as a practitioner, I take you into those moments where you're overwhelmed and burned out and feel like the ceiling's going to cave in and the business is going to close. We go into those moments. I want you to be in them. I want you to feel that activation, but I'm also going to strategically introduce joy and peace and safety so that we can get that to override that trigger that's so prevalent in your system. And over time, you start to see it. And I'm sure, Summer, you can attest to this. It's like you wake up and you're like, holy cow, that one thing that used to derail me, it doesn't derail me anymore.
Yeah, it's true. And actually, it's funny when people start to notice it. My own kids have been like, gosh, you used to get so, frazzled or freaked out about it. And then you start to be able to just notice, because I just have better tools now to notice when I'm starting to get there. And I'm like, wait a minute, this doesn't have to send me there. Like, let's just think about it. And sometimes I think I'm a little slower still of taking the breaths and thinking through it. But it is amazing when you actually understand it scientifically, what's happening. You can do something about it. And I think that's been what's so empowering, is you don't have to live in that space of survival. You want it, like you said, you want to be able to use it when you need it, when it's actually going to be helpful. And I think I think that's what entrepreneurs are searching for. The whole time they were looking to do it, to be able to have the lives they love with the people they love, doing what they love. And we didn't even recognize that so much of it could be thwarted by our own responses to the trauma and the things that we've had. We didn't even realize that perhaps that those survival responses wouldn't continue to serve us how we thought. So I think, one last question I have, our patients are showing up just like we are, right? Like they too have their own stuff. I always figure when it comes to anxiety about the dental office, being stressed out, and sometimes just like us, sometimes they show it, sometimes you can see it, sometimes they almost come in that frozen state. I know we can't, that's almost for a whole different episode, but is there anything, quickly that you can tell doctors recognizing they too have, our patients are walking in, like I said, just like us. Any recommendations? Because I know you work with other dentists too.
Yeah. Yes, actually. And I mean, we could do a whole nother conversation about this because my heart is just, I love this topic. And the first thing that I'll say is this: if you are a dentist, you have to remember that when we're talking about the nervous system, we're talking about the body, and you are working in an area that holds a lot of nerve endings and a lot of muscle memory. And so oftentimes that can be really triggering and traumatic to someone. And so what I suggest for all of the dentists that I do work with is just simply asking your client when they come in, what do you need right now? What do you need to feel more at peace, safe, right? I go to a dentist here in Denver who asks that when I walk in, only because we've been working together. And so he now has fuzzy blankets, and there's TVs now on the ceiling, and you can, watch Netflix, and he's constantly finding ways for the client to feel more peaceful and at ease, because it can be very triggering. So just simply asking a client, what do you need, is going to be huge. I'll also say this, I was working with a client a few weeks ago, and she had a pretty large dental procedure done. She was not a dentist, but she was a patient. And after her procedure, she kept having lingering pain in the right side of her mouth, which is where she had the procedure done. And she kept going back to the dentist, and the dentist kept saying, there's literally nothing wrong. Like, everything is healthy. It looks good. We don't need to do a root canal. Everything is good. Like, there's nothing to take an x-rays, all of it. She started coming to me. And so we started to work with that sensation in the right side of her mouth. And then all of a sudden, in the middle of a session, her hand went up, and I called attention to her hand, and all of these memories flooded back of her having a very traumatic event at the dentist when she was very young. And her whole body started to respond. And after we worked through it, all of a sudden the pain went away. And the dentist was like, she went back to her dentist, reported to him, and he said, what did you do? And she said, well, apparently I had something that was stuck in there, right? Mm-hmm. So as dentists, it's always really great, and I know this sounds goofy, to have a list of recommended therapists that you can hand to a client. If they feel like it's very overwhelming for them, they can work with going to the dentist with their somatic therapist. And so that's what I would recommend to dentists.
And it's funny, it's a lot of times the same thing. Like, we do realize that people have to go to the therapist to be able to fly, to get on an airplane. Because there's people who have very similar, anxiety around that. This is the same thing. And we all know those patients that they actually neglect their care for so long because of that severe anxiety. So we think it feels kind of woo-woo to be like, hey, there's people who can actually help you. People do it for all sorts of things, whether it be going out into public spaces or public speaking or getting on an airplane. This is just another one of those things that sometimes people need some extra support to be able to come and see us, if it looks like the support we can give, is beyond what we can do. And I know for a fact, we've had some of those patients where, I mean, truly, despite the best doctors doing the kindest things, it's just too much. It's just too much for that patient. So
yeah. But I mean, the body holds on to, we have to remember, the body holds on to trauma. So you can have a patient in your chair, and there could be nothing wrong with them. And it's no reflection of you as the dentists. It's the reflection of them and what they've gone through. And so I'll even have dentists that I work with say, you know what, before we do this procedure, even if it's a cleaning or if it is a simple filling, why don't you go see this therapist for a couple of sessions prior to our procedure? And it helps. It always helps, as long as you have the right person to refer someone out to.
Sure. Well, Lauren, truly thank you for all of this. I think we got really great tools. I think we now also, if there's doctors who are sitting out there thinking, is this it? Like, is this how it has to be? And all they're searching for is, when my kids are this old, when the business is here, when I have this. They're just sitting there struggling with, is this all there is? And maybe when I get this, it'll get better. I think you've given us some really lovely tools. And I know for me personally that, you know, so much of that survival response or how we're feeling is something that we can actually have control over and work on and be empowered to change. So I'm really grateful for those tools, those tips. And then I know what we're going to put on our page for people to be able to kind of go and use as resources as well. But Ashley, anything else as we kind of wrap up?
No, I just think that this was such great info, and it feels like you said, maybe it's like a missing piece. You know, it's something people haven't considered in this way. You know, it's because they're operating at this level, and I'm just very grateful for, you know, it's like looking at life from another perspective. Like, oh, maybe this is the reason, you know, my body's hanging on to all of this stuff. We've talked about the body keeps a score in DSN several times as well. So yeah, I just loved hearing from you, Lauren, and thank you so much for your time and for talking to our audience.
Yeah. Thank you guys so much for having me. This was wonderful.
Yeah, thank you so much. We will hopefully get you back again and we can talk more about the anxiety of dental patients and how can we as dentists actually help them even more than potentially we do now. But any final remarks though, Lauren, from you?
I don't think so. I think this has been such an amazing conversation. And I think it's just important to remember that, you know, even though we're talking about a lot of, you know, therapy jargon today and how to take better care of yourself, that really it just starts with getting curious. So hopefully this gave you some point of curiosity to start to lean into, and whether you get the book or you reach out for help or you just start to notice different things in your patients, just start with curiosity. And yeah, that's where I would leave everyone today.
I love that note. Thank you so much. That was awesome. I love it.
All right. Well, thank you everybody for tuning in, and thank you, Lauren. Thank you, Ashley. We will see you next time.